Hi, happy to be here again with you. This is Angela Simbi with the Mental Health Moments. And this particular time, I just want to invite everybody to come and attend our webinar. We shall be having a pre-event leading to the actual event when we award winners for the Ketura Mental Health Awards. So we are going to have a webinar, and our theme is family-centered mental health care and support. And this webinar is actually scheduled for tomorrow. Tomorrow, that is Tuesday the 10th, and it will be from 7:30 to 9 p.m. Now, thankfully, interestingly actually, September 10th is World Suicide Prevention Day, Awareness Day. So it is on that particular day that we are going to have this webinar, and we are going to talk about those details, bringing you the perspective from the clergy's side through the lenses of a clergy, and bringing you also a perspective from me, yours truly, a lived experience, but with a special emphasis on how family can support and also care for their loved ones. And so I just want also to bring it to your attention that on the World Suicide Prevention Awareness Day, the theme for that day is actually changing the narrative on suicide, encouraging also men to speak up, because it is clear that sadly, for every 40 seconds, and this is according to World Health Organization, every 40 seconds, one person dies to suicide globally. That is not good news. One person dies to suicide globally. So we need to change the narrative. We need to start the conversation. And the beauty about this webinar, it will be on Google Meet. We are bringing this conversation to you with our partners. We have very many partners. And one of those is CLC Kenya and Christian Writers Association. They are bringing this conversation to the public. So it is good for us to engage. So when we talk about family, one thing I felt I needed just to give you a sneak peek of what we should expect, and also be ready to contribute to this conversation. For example, when you are a parent, how will you know that maybe your child is self-harming? When you are a parent or a guardian, what can you look out for? Because sometimes children have unexplained marks on their bodies. They have scars on their bodies. How do you tell that there is a problem? I've engaged with some young people, and you find someone has cut themselves maybe on their lap, or they've cut themselves, they've been self-harming on their arms, and they have scars. And when you think about it, when you try to understand why are these scars there, of course, when you create an environment which is not judgmental, you're ready to listen to the person, they normally speak up and explain to you what they are going through. And most of these dynamics are family dynamics. And that's why we are focusing family, because the dynamics of family are real. It is real, you guys. If mommy and daddy relationship is shaky, normally there is a challenge there. And like one person I also engaged with who confided me and told me, I will not of course mention the name, because I'm using just the case for people to understand why family-centered mental health care. And she said, we used to see our dad occasionally, because their dad was a married man, so he was running two families at the same time. So daddy wasn't really available. He was this daddy who came occasionally. So these things also affect children, because they have questions about identity, their parentage, where do they belong? It brings questions of feeling unworthy, of feeling less. So how do we deal with all these things? Because someone doesn't just wake up one day and say they're taking their lives. No. but how do we support as a family? That's very important. And for people who don't know my story, I know some people do, but quite a number who might not know my story. And you might wonder why I'm part of the panelists. Well, my story, part of it is that I would call it maybe I'm a psychiatric survivor. I have my journey. I have experienced mental health challenges. I've walked this journey. I will not give the credit to me. I have definitely experienced family support. They have held my hand. My family has held my hand. Some people sadly are not here anymore, but family made a difference. And I want to quote a particular verse which I have written here so that we understand the value of family. And it says, it's in Psalm 68 verse 6. It says, God sets the lonely in families. He leads out the prisoners with singing, but the rebellious live in a sun-scorched land. What I want you to lay emphasis here, he puts the lonely in families. And I'm telling you, we need families very much. Another friend of mine recently had an accident which has changed a lot about her life. She's now struggling to get her mobility back. And she told me something. She's so grateful. She was overwhelmed by the support of one of the family members offering, because that family member has been with her in hospital, has had to put some of their schedules on hold. So they are juggling work and looking after their loved one. And of course, there's a struggle with someone's mental health in such a situation, because there are certain accidents which actually change the rest of your life. So how do you move going forward? And like we are saying in this conversation, don't give up. So one of the other panelists will be Bishop Michael David Chazzy. And he's coming to bring a rich experience on the table, because interestingly, I'm also one of those people who was taken to him when I was in crisis. And he told my husband, I have prayed for your wife, now take her to hospital. And the interesting thing about Bishop Michael David Chazzy is that he's a man who is so full of compassion, and he has set up a non-profit organization called COPE Uganda, COPE Community. And one of their focus areas is mental health. So he's a very unique leader in the religious space, because this is an umbrella organization where pastors, clergy, every leader in the religious space, where they are able to get information and be supported and empowered about this mental health issue. Because many people run to church. Many people will run to that mosque looking for help. Many people will run to that church wherever it is located. Other people sadly will also fall in the wrong hands, like I did. They were a part of my story, like I did. They might fall in wrong hands where people demand, you give me money, you get healed, those stories. So what is your story? Join this conversation, because we need to reflect on the dynamics of family. How do we make our families stronger so that they are able to actually support loved ones on this journey of mental health, wellness, and recovery? So save the date. It is September 10th, 7:30 up to 9. We just have 1.5 hours. We decided to do it in the evening. It's not going to be in the morning, because we know many people would love to be part of this, but we didn't want to interrupt. We also didn't want to interrupt your engagement at the workspace. So please make sure you are part of this. Looking forward to engaging, and we appreciate our partners, Crown Beverages Limited, Yana Initiative, Esther's Ventures, Vision Group, Divine Confectionaries. We appreciate every partner, Every partner brings value to the table. Toriweka, we appreciate the support. We do appreciate every member. The Ministry of Health, the Mental Health Division, we appreciate the support because you bring a rich experience and expertise from the scientific point of view to this conversation. We thank you. We give you God glory for every partner. And we are looking forward to having every partner, at least have some representatives on the call. And I thank you for listening. Please be there or be square.